Can you take potassium supplements with potassium-sparing diuretics? Have you ever wondered if it is safe to take potassium supplements while on potassium-sparing diuretics? This is an important question, especially for those managing hypertension. Let's break it down. Potassium-sparing diuretics are medications that help control high blood pressure by allowing the kidneys to retain potassium while helping the body get rid of excess fluid. Unlike other diuretics, such as loop or thiazide diuretics, which can lead to potassium loss, potassium-sparing diuretics work differently. They either block potassium channels in the kidneys or counteract a hormone called aldosterone, which usually promotes potassium excretion. Common examples of potassium-sparing diuretics include amiloride, triamterene, spironolactone, and eplerenone. Now, here's where it gets tricky. Since potassium-sparing diuretics reduce the amount of potassium that the kidneys eliminate, they can lead to higher potassium levels in the blood. If someone takes potassium supplements while on these medications, it can result in a condition known as hyperkalemia. Hyperkalemia is when potassium levels become dangerously high, which can lead to serious health issues like irregular heartbeats, muscle weakness, and even cardiac arrest. Because of these risks, potassium supplements are generally not recommended for individuals taking potassium-sparing diuretics unless a healthcare provider specifically advises it. This caution extends to dietary potassium as well. It is important to manage potassium intake carefully to avoid excessive accumulation in the body. In some cases, potassium-sparing diuretics may be prescribed alongside other diuretics that cause potassium loss. This combination can help balance potassium levels. However, even in these situations, potassium supplementation should only occur under the close supervision of a healthcare professional. The effects on potassium levels can be unpredictable. For those managing hypertension, it is essential to understand that potassium-sparing diuretics can be effective in controlling blood pressure while conserving potassium. However, taking potassium supplements with these medications can lead to elevated potassium levels. It is best to avoid potassium supplements unless directed by a physician. Regular monitoring of potassium levels is crucial to prevent complications. Discussing dietary potassium intake with healthcare providers is also important to maintain a safe balance. In short, if you are on potassium-sparing diuretics, it is wise to be cautious about potassium supplements and to consult with your healthcare provider for personalized advice.